Well done. So can you go back and just sit on the bed again? I just need you to practice that, okay? And use a mirror if necessary, okay? It's really nice to use a mirror. Use the opportunity if you're passing by a mirror, passing by shop mirrors, shop windows, and people often say if they see themselves in a photo, and they really just use that opportunity just to correct themselves as well.
Okay.
Okay. So sometimes it goes beyond posture, and sometimes there is a genuine alignment problem with the pelvis, all right? I'll just explain that to you. I have here just a spine and a pelvis. And what can happen here, the pelvis is made up of 3 bones. This is the ilium on either side, so 2 ilia, and the sacral bone in the middle, okay? So the sacrum there and the iliac bone on either side. Now there's a sacroiliac joint on either side, okay? So I think a lot of people know the name the sacroiliac joint. You've probably heard of that. And the pubic symphysis bone here to the front. Now, normal would be in pregnancy that there is separation of the pubic symphysis bone from 4 millimeters out to 9 millimeters. Okay, you can imagine that's quite a bit of separation, and that is normal. And the sacroiliac joint would also increase a little bit in mobility as well. Okay, but there would be more increase in mobility at the pubic symphysis. And what happens then is these bones will move slightly forwards, and there's a slight opening backwards of the sacrum and the coccyx. And that, of course, is going to very importantly increase the opening for the birth of the baby. So the problem is that there can be an increase more of mobility on one side than the other. One side can be what is called hypomobile, it's not moving too well, and the other side can be hyper, where it is moving too much. So it's not necessarily that there's this laxity. Now, certainly in pregnancy, there is the hormone relaxin, which kicks in the first trimester, so the first few months, the first 3 months, that will kick in. And it will cause some loosening of the ligaments, but it's not the main thing that causes problems, right? Very often it's going to be the asymmetry of the pelvis, one side moving forwards a little bit more than the others, and that would be accentuated by things like the posture when you were standing there. And also if you have children, and you have 2 already, sometimes there's the whole standing thing and holding a child on the hip. And of course that's going to cause one side to come up or raise a little bit more in relation to the other.
Okay.
So what we have to do is see whether with you there is an asymmetry at your pelvis. Okay, we want to have a look just at your lumbar spine. We would look at your lumbar spine and we would look at your hip, but it's going to take too long, and I don't want to do all of that now. And I want to just really, for purposes of explanation, talk about the pelvic girdle as such. Okay. So one of the things that I would do, I just want to have a look at you lying down. Okay, are you going to be comfortable lying down onto your back? Yeah. What we're going to do is, normally, pregnancy-wise, we wouldn't like you lying down on your back for too long, okay? But it's fine getting you to lie down just to have a look at the position of your pelvis, all right? If I had you lying down for too long on your back, then you could get hypotensive or dizzy or feel a little bit faint, okay? And that would be as a result of the baby putting too much pressure up on your arteries, at the arteries and veins up, and it would stop the blood flow or impede the blood flow a little bit as it returns to the heart. So that's not going to be good for your baby, of course, all right? So, and you're going to be becoming a little bit dizzy and you would get uncomfortable. But I don't mind if it's okay with you. It's okay safety-wise to have you lying down just for a short period of time while we evaluate that, okay?